Hello and welcome. My name is Alice, and I'll be in the background answering any Zoom technical questions. If you experience difficulties during this session, please type your question into the Q&A. We encourage you to submit written questions at any time during the presentation using the Q&A function, which should be located at the bottom of your screen. With that, I'd like to introduce Autumn Boylan, Deputy Director of the Office of Strategic Partnerships at DHCS.
Thank you, Alice. Good morning, everybody. Thank you so much for joining us for today's webinar. Today, we will be talking about the Correctional Facility Readiness Assessment for the CalAIM Justice Involved Reentry Initiative. We're happy to have you here with us today and excited to be moving forward in this work. We're really committed here at DHCS to making sure that we are supporting our correctional facility partners to lift up this very complicated new program. And we want to continue to offer these office hour sessions, technical assistance, opportunities, and support to use to make sure that we are giving you all that you need to be successful in lifting up this initiative. Today, we're going to really be focusing on the Correctional Facility Readiness Assessment, which was released by DHCS in February. It did go out to our correctional facility partners via email in February. We're working on getting it posted to our website, and we'll have that up by early next week. We'll also send it again via email after today's session to all of the folks who are registered for and attending today's webinar. The readiness assessment template is really kind of the roadmap of what the correctional facilities will need to demonstrate in order to show that they are ready to implement the CalAIM Justice Involved Initiative by the anticipated and requested go-live date. As you know, the earliest go-live date for this initiative is October 1st of 2024. And any correctional facilities that are wanting to go live in October will need to be submitting the readiness assessment package to DHCS for review and approval by April. So today we'll really provide an overview of that process, the timelines, and it'll be a repeat of the presentation that we gave at our last meeting to really help make sure that folks understand the information, but also to provide information to those correctional facility partners who were unable to attend our last event. We will spend a bulk of our time today, though, responding to questions. So if you do have questions, please do submit them to the questions, the Q&A box, so that we can answer your questions during today's webinar to the extent that we can, and then or follow up with frequently asked questions following today's session. We'll answer as many questions today as we possibly can. So just a reminder, a bulk of today's presentation will be a repeat of information that we've previously provided, and then we'll spend most of our time answering your questions. So that's kind of where we're at for today. This is our agenda, and I'm going to turn it over to my colleague at DHCS, Greg Tate, who is the section chief of the Correctional Facility Oversight Section in our Justice Involved team, and he's going to lead us through our content. Greg?
Thank you so much for that, Autumn. I appreciate it. So let's see. As Autumn said, this is a repeat of our meeting that we did on February 15th. Let's see, before we get started, just a reminder that we encourage you to submit your questions at any point during the webinar using the Q&A box. And you should see at the bottom of your screen down there that we'll be collecting those questions throughout the presentation, and we'll respond to them during the second half of the meeting. Our agenda today is an overview of the Correctional Facilities Readiness Assessment template, and then we'll get into the Readiness Assessment completion and submission process. We'll do our Q&A, and then we'll also end it with our next steps for the next one. Next slide, please. Next slide, we're going to start the presentation. All right, so this is our Correctional Facilities Readiness Assessment requirements. As you are likely aware, as a condition of the Section 1115 demonstration, all prisons, jails, and youth correctional facilities are required to demonstrate readiness to participate in the Justice Involved Initiative and receive DHCS approval prior to going live with pre-release services. DHCS will require each correctional facility to complete and submit a readiness assessment template at least 6 months prior to its planned go-live date to demonstrate its readiness to provide pre-release services and behavioral health links. Readiness assessments will be conducted on a quarterly basis and will focus on 5 key areas. On this slide, it says the first area is Medi-Cal application processes, also 90-day pre-release eligibility and behavioral health link screening, 90-day pre-release services delivery, reentry planning and coordination, and finally, oversight and project management. Notably, and in the change from previous policy readiness decision and approval for go live will be made at the individual facility rather than at the county level. Next slide. This is the correctional facility assessment overview. The readiness assessment template contains a series of attestations, narrative responses, and in some instances, requests for supporting documentation. Most readiness assessment elements are categorized as minimum requirements, which indicate that a correctional facility must demonstrate the capability will be in place by the go live dates as a condition of approval. The correctional facility must also demonstrate the ability to meet the 3 readiness elements categorized as non-minimum requirements within the 6 months after going live date. And those are clinical consultation, support for durable medical equipment upon release, and governance structure for partnerships. To receive approval from DHCS to go live, a correctional facility must receive an approved score in all 5 focus areas, indicating readiness to meet minimum and non-minimum requirements within specified timeframe. If DHCS does not approve the correctional facility for go live, we will, of course, work with the correctional facility on updating their existing submission and or developing an action plan until approval is granted. Facilities are encouraged to use PATH dollars and funding to support the planning activities that are necessary to demonstrate readiness. Facilities can also leverage information from PATH-JI capacity building program progress reports to build out relevant sections to the readiness assessment. Sorry about that. Next slide, please. Yes. In October of 2023, DHCS released a draft correctional facility readiness assessment template for stakeholders' comments. DHCS updated the readiness assessment template based upon stakeholders' feedback. Updates to the final template that were released in mid-February primarily focused on providing additional guidance for correctional facilities on how to gather information for completion and submit the readiness assessment template, improving the user-friendliness and clarity of the readiness assessment template format, and finally, updating attestations, narrative responses, and documentation to reflect the most up-to-date policy and operational guidance. Next slide, please. DHCS updated the attestations section of each focus area to allow correctional facilities to more clearly denote readiness status and timeframes that meet readiness for each minimum requirement. We've included an example of the updated attestation table on this slide. As you'll see, we have also added the ability for correctional facilities to request technical assistance from DHCS if it's unable to meet the given requirements by the deadline for go live. Next slide, please. DHCS has updated the narrative response section for each focus area to establish word counts and provide space for correctional facilities to enter responses. We've included an example on this slide of what you should expect to see for areas where narrative responses are required. Next slide. Finally, DHCS has also updated the supporting documentation section for each focus area to clarify supporting documentation requirements, including which types of documentation are required or which types are optional. Next slide. This slide shows a few additional template updates we made as well. So the scoring rubric, we updated the scoring rubric terminology to approved, not yet ready, or denied. As indicated earlier, we have also updated facility level approval. So DHCS will issue readiness decisions and go live approval at the individual facility rather than at the county level. Joint submission process on slide 3, slide 3 here, in recognition of the fact that some small counties do not have a jail or youth correctional facility, and instead contract with surrounding counties to house their incarcerated youth and or adult populations, DHCS has added guidance for the readiness assessment template regarding joint submission processes for these counties. In these instances, the county housing and incarcerated individuals provides healthcare services to incarcerated individuals and will provide pre-release services upon go live, while the county without the youth or adult facility may provide upon go live. A subset of reentry initiative services, such as reentry planning and coordination services during the pre-release period. For these counties, DHCS will require a joint readiness assessment submission process. Specifically, this means that the governmental entity that is accountable for providing health care to youth and or adults incarcerated in the county's correctional facilities and upon go live, that will serve as the pre-release services billing entity and its entity accountable for is the entity accountable for completing the readiness assessment. Basically, they're going to be the prime county. The prime county may contract with other counties, partner counties, to provide pre-release services components under the prime facilities NPI. Partner counties should notify DHCS of intent to contribute to the readiness assessment submission of any prime counties in which it contracts via email to receive additional details on joint submission requirements. Partner counties who will provide a component of pre-release services packages will be required to contribute to the readiness assessment submission of any prime county with which it contracts in order to demonstrate partner county's readiness to provide those specific pre-release services. Correctional facilities must also submit a letter from their county's behavioral health agencies indicating a mutual agreement on the behavioral health link screening tool and process. DHCS has also added attestation related to the compliance and with future oversight and monitoring efforts. Also, we've added a section for the go live date requests. Correctional facilities must indicate the requested go live date and have their readiness assessment signed by the authorized individuals who will be accountable for implementing the readiness initiative. Sorry about that. And lastly, MOUs on this slide. The template requires the correctional facility to attest to their willingness to enter into a forthcoming MOU with DHCS. DHCS is currently working to draft the MOU and plans to make it available to stakeholders in the next coming weeks. Once the MOU has been finalized, correctional facilities will be required to sign the MOU prior to their go-live dates as a condition of their final approval. Let's see, next slide. Slide 12, thank you. This slide provides additional details on the readiness assessment submission process, including correctional facility and DHCS responsibilities during the readiness review, and includes a sample timeline for those facilities that are seeking a go-live date on October 1st, 2024. As noted previously, correctional facilities must submit the completed readiness assessment template to DHCS at least 6 months prior to the requested go-live date, no later than March 31st, 2026, in order to ensure that the facilities are able to go live by October 1st, 2026. This table on this slide shows an example timeline of submission readiness determination. In February through March of 2024, correctional facility is responsible for convening a working group of key professionals and leadership, and also complete the readiness assessment template. During this timeline, DHCS will address questions and provide technical assistance to any correctional facility that's requested. The next time frame, from April to June, the correctional facility should submit their readiness assessment template to DHCS by April 1st, if they're planning to go live by October 1st. and they should also respond to any questions from DHCS or requests for additional information and notify DHCS when areas are marked ready upon go live as ready or needed. During this time, DHCS will elevate the readiness template submission and follow up with the correctional facility to address any questions and provide any feedback. In July of 2024, in this example, DHCS will make the final determination of readiness for go live and communicate the decision to each of the correction facilities. And then in July through September, if the correctional facility is approved, they should start preparing to go live with pre-release services, including entering into an MOU with DHCS. If they were deemed not yet ready, they should notify DHCS when areas marked as ready to go live already and prepare to go live with pre-release services, including entering the MOU with DHCS. And if they are denied, they should resubmit the template on a quarterly basis until they are approved. During this time frame, DHCS will work with the correctional facilities. If they are approved and not yet ready, DHCS will then enter into the MOU with the correctional facility, provide any technical assistance during the preparations to go live. And the correctional facility was denied, DHCS will provide any technical assistance in the correctional facility so that we can help the correctional facility to achieve their readiness. In this example, correctional facility achieved readiness according to the timeline. Then starting on October 1st, 2024, they can begin providing pre-release services. And then by April 1st, 2025, the correctional facility should confirm to DHCS that all non-minimum requirements are live. And then DHCS will continue providing ongoing technical assistance to the correctional facility and support ongoing monitoring activities. Please keep in mind that in the example timeline based on if the correctional facility would like to go live as of October 1st, 2024. If the correctional facility wants to go live after that date, after October 1st, 2024, then of course, this example and the timeline will shift and accommodate whatever date they choose. Next slide, please. Here's our poll. And so while we're on the topic of timeliness, and in order to better inform DHCS of planning efforts, we would love to get a better idea of when facilities are planning to go live with pre-release services. So you should see a poll that just popped up on the screen. It kind of startled me a little bit. But if you can just select the time frame from which your correctional facility plans to go live with pre-release services, that would be extremely helpful to us. And it would give us I'll give everybody a couple seconds to figure out which one they want to indicate, and then we will convene back on this. So let's give you some time to pick the responses. I don't know if the responses are going to pop up for me or not. We'll give a couple more seconds for everybody. You good to go? All right. Thank you guys for entering in your information. Let's move forward. This slide provides a little more detail, step-by-step instructions on the process for completing and submitting the readiness assessment template. I'll walk through the workflow here on the slide. So first, the correctional facility should convene a working group of professionals. Wait, we're doing this one already. Convene a working group of the professionals, leaders, which include leadership, health providers, care coordinations, and contractors. Next, they should assign each section of the readiness assessment template to relevant professionals to provide more information. Third, they should determine a go-live date. Please note that the correctional facility must go live between October 1st, 2024 and September 30th, 2026. And the readiness assessment template must be submitted 6 months prior to the planned go live. The fourth step is that DHCS will convene with the correctional facility, and they should review the readiness assessment template and assess whether the correctional facility meets the listed requirements. The fifth step is to indicate whether the correctional facility meets each of the listed requirements by marking the checkbox to attestation. The sixth step is to develop a narrative response that describes how the correctional facility meets the listed requirements by the requested go-live date. The seventh step here, of course, is to compile any of the supporting documentation for the readiness assessment. Next is to review and sign the required list of additional attestation that are in the section 3 of the readiness assessments. Next, you compile and review and revise the readiness assessment template responses as a working group. And then lastly is to submit the completed readiness assessment template with any supporting documents to DHCS using the secure file transfer. As noted on the bottom of the slide, correctional facilities may contact DHCS with questions as they fill out the readiness assessment template. And you can also request technical assistance when you're doing this as well. Next slide, please. Readiness evaluation approach. This slide describes the approach that DHCS will take when evaluating the correctional facility's readiness assessment template submission and determining their readiness to go live with pre-release services and behavioral health links. As noted on the slide, DHCS will determine a score for each focus area based on the correctional facility's attestations and narrative response. DHCS will determine the correctional facility's overall readiness assessment score. So for approval, excuse me, guys. So approval, or to be approved, responses are complete and indicate readiness in each readiness element on the focus area. Not yet ready, the response is complete and indicates that the correctional facility meets some, but maybe not all, of the components for the template. And being denied will indicate that response is incomplete and do not sufficiently address the narrative questions, or the submission does not indicate readiness to go live. And at this time, next slide, we welcome your any of your questions and comments on the readiness assessment template and submission requirements. I think I've had Manat in the background on the Q&A in the inbox, so they'll be getting those ready for me, and then we'll try and get those answered accordingly.
Thank you so much, Greg. And good afternoon. Good morning, everyone. My name is Allison Garza-Monday. I am with Manat Health, and I am part of the team that has been supporting DHCS in their planning and implementation of the Justice Involved initiative. And today I'm going to be helping facilitate our question and answer portion of the discussion. So just want to encourage you, I know Greg said it a couple of times, but there is a Q&A box that you should see at the bottom of your screen. So thanks to those folks that have been submitting their questions throughout the course of the presentation, as well as some folks that actually emailed some in advance as well. Very helpful. Please feel free to type any additional questions that pop to your mind as we progress through them. So thank you again. Greg, I'm going to start with a few that are just kind of processy, submission process and protocols oriented. The first question relates to whether or not documents will be submitted for the readiness assessment the same way that documents have been submitted for PATH. So I believe in the PATH context, we've been using, DHCS has been using the Grants Connect, and this individual is wondering whether that will be the same process for the readiness assessment submission.
It is not going to be the same. Documents actually will be submitted via a secure file transfer email. The correctional facility should reach out to the JI inbox, which will submit the link later on, or actually I think it's on the last slide. The JI inbox to indicate that they are planning to submit, and then OSP JI team will coordinate submission and the secure file transfer. Thank you for the question, though.
Excellent. Thanks, Greg. So we got a couple of questions as it relates to how the quarterly cohorts are going to work and whether if somebody misses the deadline, for example, for the April 1st cutoff, if they're able to go live on a monthly basis and just, let me read it specifically. Do we have to push the go live date to the next cohort in order to meet the 6-month time frame to go live if they miss that April 1st or a future deadline?
The facility's readiness assessment will be reassessed on a quarterly basis. If the facility is not deemed ready to go live, once they are deemed ready to go live, they can go live on the next cohort. So hope that answers that question.
Yeah, that's right. We will only allow go live on a quarterly basis, not on a monthly interim in between. So if you miss the cutoff for the first cohort, for example, you would be eligible for the next cohort in January. One thing in answering that question that I'm going to say something new that my team hasn't heard before, but I think, the deadlines for submission of the readiness package should be considered no later than dates. But correctional facilities could certainly submit early. So in the specific example that was posed in the question, or in one of the questions that we received, it said, if we submit in May of this year, does that mean we could go live in November? The answer to that is no. You couldn't go live until January of 2025. However, you could still submit in May. You don't have to wait until July to submit your readiness package to DHCS. That'll give us longer to review. And particularly if you're not sure if you actually meet the readiness criteria, then that might help us move something up into the queue to provide necessary technical assistance. So I would, again, consider those to be no later than dates 6 months prior to the requested go live, but go lives will only be approved on a quarterly basis.
Thank you, Autumn. Appreciate that.
Thanks both. Very helpful. Another kind of nitty question in regards to just the details of submitting the form. We had a question asking whether DHCS plans to post a fillable form of the readiness assessment template to just ease the burden of submission on that.
That is definitely the plan. DHCS will be posting a fillable form of the version for the readiness assessment. It's just forthcoming at this time. We are in the process of it. It's in the final stages. We're just not quite there yet. So keep your eyes out. It'll be there soon.
And just so folks know, the holdup is really around the we have to make the document ADA compliant. And so there's a whole remediation process to ensure that we're compliant with all of the Americans with Disability Act requirements. And that's taking a little bit longer than we expected, but that should be posted shortly.
Thanks, Autumn. We have another question. We'll start turning to a few more of the policy-oriented ones, but another one that relates to the submission process. And that's whether DHCS plans to release any examples of completed readiness assessments so that facilities can just get a better sense of DHCS's expectations around responses, whether there'll be any sort of examples.
It's a great question. Actually, DHCS is currently working with the partner county to develop we call it the gold standard, put that in quotations because it's been very fun working with them. They're going to be the example of readiness submission, and with the exact timeline for publication on this information is still to be determined. But correctional facilities are welcome to contact DHCS for technical assistance and or clarification on any expectations for their readiness submission or anything that's going on with that. We are always available for TA and willing to help, but the gold standard should be coming out hopefully soon.
Thanks, Greg.
Yeah.
One more on process and protocols. I'm looking at our list and just making sure that I am not missing anything. This one asks whether DHCS will accept draft policies and procedures as supplementary documentation for their readiness assessment submission.
Yes. DHCS, we accept draft policies and procedures as long as they're marked as such. Like you need to indicate that this is draft policy and draft procedures, and it's planning on being your current policy and procedures.
Excellent.
I would just add that it would be also helpful if you are submitting drafts to have an understanding of what the process will be to finalize the procedure. So for example, if the reason that it's still in draft is because it needs to be approved through some formal process within the county, then that's a helpful explanation to understand why it is in the draft state as opposed to a final policy.
Helpful distinction. Thanks, Autumn. So we have a question that came in that relates to the JI portal. And it asks, I understand that DHCS is creating a justice-involved portal to administer the 90-day pre-release services, and the portal will also provide information such as MCP assignment. Are these portals, the screening portal and the justice-involved portal, one and the same?
There is one portal, and the name for the portal is just going to be the Justice Involved Screening Portal. This term will be updated in the next release of the Policy and Operations Guide, but I think they just decided that that's going to be the name, the Justice Involved Screening Portal. So yes, they're one and the same.
Thanks, Greg. Helpful point of clarification, and it's good to hear that the Policy and Operational Guide will make sure that's standardized throughout in its next update.
And so that's updated quarterly as well, by the way, just so people know we're updating the Policy and Operation Guide as much as possible. So thank you.
Awesome. Thanks, Greg. So this question relates to unknown release dates, and it asks, if the release date is unknown but is expected to be less than 90 days, can the aid code be activated?
Yes, the answer to that is the aid code should be activated as soon as possible for individuals with anticipated stays of less than 90 days, or for those with unclear anticipated lengths of stay at the time of entry. The release date is not needed to begin the 90-day period, so we don't really need the release date just to start it. Autumn, you came off mute, so do you want to add to that? Because
I would just say, I think we would want folks to put the anticipated release date in the screening portal, but that could always be updated. But that is how we track the total 90-day period. So from the date of activation in the JI screening portal, based on the release date is how we track the 90-day period. So if, for example, you expect that somebody will be released on May 15th, but then that changes, you can always go back into the portal and update that information, but we would want to know what the expected release date is when known. But I agree with everything that Greg said as well.
Thanks both. We have one more billing question, and perhaps we'll turn to some as they relate to correctional facility enrollment and also some billing, but as it specifically relates to NPI and other issues. So this billing question asks about a potential pause in billing. And it says, can we bill for the first 28 days along with the last 90 days if a person is in custody for an extended length of time? Or can we only bill one or the other, or a combination approach? So again, this is for folks, whether you can bill for the first 28 days prior to coverage being suspended, and then can you bill in the 90 days of the pre-release services if that person is in custody for an extended period of time?
Autumn, you came off mute again. You want me to answer that, or you got it?
If you've got an answer, go ahead.
I got an answer. It is possible in this specific scenario where individual may receive 28 days of pre-release services, have a pause to the JI code, the JI billing code, and then reset for a new period of 90 days pre-release services once a new release date is established and falls within the 90 days of release. It's the pause reset scenario that we've been working on diligently here at DHCS. Autumn, you want to add, or I think that answered it.
Great, thanks. And I think additional details on those, on that is available in the Policy and Operational Guide as well.
Yes, ma'am.
Thanks, Greg. Coming at you with more questions here. Okay, so this one is one that we've heard in several of our sessions, and it relates to the requirement for correctional facilities to enroll as an exempt from licensure clinic. So the question states, a correctional facility plans to contract with a vendor to provide embedded CalAIM pre-release services. Is the correctional facility required to apply for an exempt from licensure clinic status for the facility, or can the correctional facility delegate that responsibility to the contractor?
Wow, that's a long question.
I'm
let's
happy
see.
to state it again if it's helpful, Greg.
Yeah, please, could you?
Absolutely. So a correctional facility is planning to contract with a vendor who's going to provide the embedded CalAIM pre-release services. In that scenario, does the correctional facility still need to apply to be an exempt from licensure clinic, or can the correctional facility delegate the responsibility to apply and enroll within Medicaid to the contractor?
Got it. Carceral healthcare facilities must enroll to be exempt from licensure clinics. For the purpose of the program, a carceral healthcare facility could be a correctional facility, or it could be county health department responsible for providing healthcare services to an incarcerated individual. So basically, third-party vendors contracted by correctional facilities, for example, WellPath, are not able to enroll as the exempt from licensure clinic and would instead bill under the correctional facilities MPI code. Is that kind of what they're asking? I think that's what I got from that question.
Yes, that was great, Greg. Thank you.
I'm sure they can always inbox us and we can get more answers if we need to.
Thank you so much. Yes, absolutely. If any additional clarification is needed, please do ping us in the Q&A. So one more question on billing, and I'm just trying to look across our questions. Thanks so much for submitting so many good ones. I want to make sure we cover as many as we do. This relates just to getting a sense on best practices for billing and how correctional facilities are thinking about approaching this. And the question is, how are other facilities implementing billing processes? Are they outsourcing the process? Are they utilizing specific software?
It's a great question. And while I'm thinking about the answer, we do encourage all the counties to communicate with each other as much as possible on answering things like this, because they come up and all the counties are dealing with the same questions. So trust me, don't feel bad if you have to call another county and ask. As facilities build out their billing processes, DHCS encourages collaboration, like I said, amongst correctional facilities to share information on approach and emerging best practices. DHCS will also take back this question and potentially incorporate it into the billing best practices for TA for future resources. We don't really have an answer, but we can always take it back. And anytime there's a TA request, we can always try and link counties together so they can communicate, or y'all can do it yourselves as well, because we encourage that. So
that's great, Greg. Thank you so much. So we'll take a breather on the billing questions. I have another question that relates to kind of just the process for evaluation. And this one asks whether or not a facility can go live in stages. So for example, if the facility meets 2 of the 5 minimum requirements, can they notify DHCS that they're ready on those and go live, or do they have to meet all the minimum requirements to go live? And I think Autumn had indicated she wanted to take this one.
Great, thank you. At this time, based on the information that we put out about the readiness review process, the expectation is that correctional facilities at the facility level do meet all of the focus areas outlined in the readiness assessment template, with the exceptions that are already documented in terms of conditional approvals for specific items where there is a specific plan and end date for when those items will come into compliance. However, we are also looking at options for additional flexibilities in this space. It's just too early into that process for us to speak to details, but we are, based on all of the conversations we've been having with our correctional facility partners and county correctional healthcare services providers, we do understand that it may benefit us as a state and as local entities to have some more flexibility. So we're looking at that really carefully. And at this point, we can't commit to anything. And what we've put out and what folks who are, particularly those who are planning to apply to participate in the October cohort, should continue to demonstrate readiness across all focus areas detailed in the readiness assessment template.
Thanks, Autumn. That's helpful and a good question. Another one that relates, again, just to sort of the ins and outs of the submission process, and that just asks, can you please confirm that referencing additional details for the readiness assessment by referencing attached documentation is acceptable? In other words, can you kind of build out your response by referencing documentation that you've submitted to supplement your answers?
Sorry, I was on mute. Yes, it is acceptable to reference the documents attached to the readiness submission within the facility's readiness assessment and narrative responses.
Excellent, thank you. We have a question that relates to the joint submission process for partner counties, and it's just asking whether or not DHCS is able to provide additional written documentation as it relates to that joint submission process.
Yes, the information will be included in the transcript form from this webinar and from previous webinar as well, and it includes the instruction section of the readiness assessment. The DHCS will additionally include the language in the next update to the policy and operational guide. Partner counties should notify DHCS of any intent to contribute to the readiness assessment submission of any prime counties with which it contracts by emailing us at the CalAIM Justice Advisory Group email, which I'm sure is posted, and if it's not, we'll put it in the chat. And we'll receive additional details on the joint submission requirements. And DHCS will also consider providing an example of scenarios via future technical assistance resources.
Excellent, thanks, Greg. We have a question. Oops.
Sorry, go ahead.
We have a question, and I think we got this. Thank you. You might have been pointing out the same thing, which is that the email address that Greg just referenced has been dropped into the chat, and we will follow up. It's also in the slide deck materials, so there's a few places you can find it, but in our distribution after the meeting, we'll make sure that that email address is included there as well for any additional questions that you might have. So our next question relates to PATH funding. And it asks, PATH funding permits facilities to cover certain staffing costs up to 2 years. If the facility goes live on January 1st, 2026, are they allowed to claim staffing fees through December 31st, 2027?
PATH funding is for staffing supports. Will be capped at 6 months past the approved go live date. So I guess the answer to that is no.
Excellent. Thank you so much. Just scrolling through all of the great questions, making sure we're not duplicating. So there's a question that asks, for those counties who go live before the policy and operational guide is updated, how do we ensure that we are meeting those requirements?
The policy and operational guide is final and accessible on the DHCS website. The guide will be updated on an ongoing basis based upon what we learned throughout the whole implementation process. And DHCS will work with those facilities and counties to ensure future compliance. So you'll know you're doing a good job because we'll be communicating with you.
And also, I would just say, like, any changes that we make are to clarify the guidance. It wouldn't be to change direction. So if you're working towards meeting the requirements that are in the October 2023 version of the policy and operations guide, then you're doing the right thing. Any updates that we make are to further clarify based on all of the questions and answers that we've gotten, or based on anything, but it's not a wholesale change in direction. So you're on the right path if you're following the October.
They're not going to make you pivot your whole program to make any changes like that. So
Thank you so much. So we had a couple of questions relating to the process of getting a facility's MPI, and specifically where should they go. I'm assuming that means sort of within the DHCS infrastructure to get enrolled in Medi-Cal as an exempt from licensure clinic. Can you provide more information on that? And I think we have a website that we can link in the chat for folks. I'm sorry, a slide deck that provides additional information.
yeah, we do. Medi-Cal clinic enrollment is processed through PAVE, and the counties can access a walkthrough slide deck at the link that they're going to provide there. I believe there's examples of the process. Autumn just posted it. I think she posted it on there.
Yeah, we'll make sure that gets out to participants.
I would just say that the PAVE enrollment process is distinct from the process for obtaining an NPI number. The NPI number does need to be obtained through the National Provider and Practitioner Enumeration System, or NPES. So you first get the NPI number and then go through the enrollment process. These are distinct processes. And DHCS does not assign the NPI number. That's through that national database. But more information is in that slide deck that was just posted in the chat.
Helpful, thank you. That is an important distinction. So just taking a minute to look at all the great questions coming in. This one asks, does this, and I imagine that means pre-release services and justice involved related services. Do pre-release services only apply for sentenced inmates, or are they also for justice involved individuals that come in for minor charges where they may get released at bail or arraignment? In other words, are services available to both individuals pre-sentencing and post-sentencing, if I am understanding the question correctly?
Yeah, thank you. I think the question really gets at, like, the pre-adjudication population in county jails, and our policy guide does take this population into consideration. I would direct your attention to the short-term model in terms of, at intake, what are the best practices and recommendations that we have for steps that you would take to provide services to those populations. So, for example, in the guide, I mean, we understand that most of the people that are in custody in county jails are individuals who are in and out within 48 or 72 hours, or even less in some cases. And so, there are some preliminary steps that you can take, but we do also understand that, a whole host of care management supports and physical consultation services would not be accomplished during that time period, but you could check the individual's eligibility for the Medi-Cal program, whether they're enrolled, help them start on an application process. Those are best practice guidelines and not mandatory components that we would hold you accountable for from a compliance perspective. But again, I would suggest folks take a closer look at the policy and operations guide language related to the short-term model and expectations there.
I was gonna say, as long as they meet eligibility criteria as outlined in the P&O. So, but Autumn said, perfect.
Thank you. And this question kind of builds off of this theme of, finding opportunities to link with other correctional facilities that are planning to go live around the time that you have, or perhaps in the future that have already gone live. And that's the question, which is just, is it possible to know which counties are planning to go live in October of 2024, or who have already gone live, obviously, once the program is up and running and folks have made it through the readiness assessment process?
Yeah, we're actually planning to develop and maintain a publicly accessible report on the DHCS JI website to display the pre-release services, go live dates for correctional facilities in each county, and plan on updating it on a quarterly basis as well. So everyone will be able to see who's going live, who's planning on going live, and everything like that. So yes.
Thank you. That's great. They're coming in fast and furious. Thank you guys so much for being so engaged and sending such great questions. Kind of on a similar note, again, just looking for places to find assistance. It asks, can you identify a county that's been successful on getting their facility MPI? How can I get assistance in the middle of the process of doing so? And it has been difficult.
I would suggest that you reach out to us via email at the CalAIM Justice Advisory Group email address, and that way we can provide specific technical assistance for your county. We do have, some folks who can provide some additional support in that space, but we'd like to better understand what is causing you to get stuck, so that we could provide the appropriate support. I don't know if we know the answer about like which counties have been successful, but encourage you to share information with each other, or if somebody wants to pop in the chat that you've navigated this process successfully and can offer some technical assistance, that also would be great.
Yep.
That's helpful, Autumn. And we are processing all of your inputs through the Q&A box, so feel free to drop it into the Q&A box. We will log it as well, and make sure that we make that connection on your behalf as well. I am just giving one more look to the questions that we have coming in, see if there are a few that we have not had the chance to ask. So it sounds like there is a county that has begun moving forward with getting their secure file transfer set up in order to submit their readiness assessment. And it looks like they're asking whether or not there's an instructional video or a manual on how to go about submitting their readiness assessments. So just checking how folks can reach out to get additional information on readiness assessment submission.
The correctional facility readiness assessment will be submitted via secure file transfer in the JI inbox. They can contact the inbox to alert any of the teams so that we can provide them any opportunity to upload it or any technical assistance or anything they need help with. So hopefully.
I think the question is really like, do we have training materials that we can share with folks? Like, have we put together a webinar or a deck or something that gives explicit instructions? I mean, I think today's webinar is meant to be a walkthrough of how to fill out the the attestations and all of those pieces. If there are specific things that we haven't covered in today's session that would be helpful, we can consider putting some additional resources together, but we have not prepared anything in addition above what we've shared with you today at this point. We are, however, as Greg just indicated, happy to provide technical assistance and support to individual counties, or even to groups of counties if folks need support. And we've been doing technical assistance calls with various counties already, and so happy to continue to do that if you need additional support in completing your readiness assessment. I would say, like, it would be helpful to our team if folks kind of self-prioritized in terms of the next few weeks. If you're not planning to submit in April, we may actually push that out into, until after, a later date, so we can prioritize those correctional facilities for technical assistance that are planning to submit their readiness package for April for an October go live. But happy to provide the support and build out additional technical assistance resources to the extent that that would be helpful for correctional facilities to do this work.
Thanks, Autumn. That's really helpful. So I have an eye on time. I'm gonna go ahead and ask one more question, then we'll just take a look and see if there's any others we have time for. And that is essentially how release dates will be captured in the context of this program. So this individual notes that they've read in materials such as the implementation plan, that the correctional facility will be required to notify DHCS of the release date for an incarcerated individual. How will this work? How should correctional facilities be notifying DHCS of a release date?
Release dates will be captured basically on the Justice Involved screening portal. So you should notify us with that if they're capturing it correctly in the portal.
Excellent, thank you. So I see that we are just about at time. I want to thank you all so much for submitting your questions. I do just want to note that a few folks asked via the Q&A whether or not materials from this session would be made available following the call. The slides, a transcript of the session, and a recording will be posted to the DHCS Justice Involved webpage in the coming days. So please do feel free to take a look there. And with that, Greg, I will turn it over to you to thank everyone for joining us today.
Awesome. Definitely want to thank everyone. Thank you guys for coming, and thank you for being on here with us. We encourage you, of course, to send any other additional questions that you have to the OSPJI via Justice Involved inbox. With that, I'd like to conclude our office hour sessions, and we look forward to continuing to work together with all of you during your readiness assessment submissions and for future launch of your Justice Involved Initiative services. I appreciate it. Thank you so much.